Hi everybody, welcome to today's episode. This is your show Being Me and I'm your host Caroline Gaiduma. I have been learning so much from this show, and this is really a self-awareness toolbox where we tell you about all the healing and wellness modalities that are available in this country to help you safeguard your emotional and mental well-being. So in today's episode, we are talking about muscle therapy. And we have an amazing therapist, Njenga. Hi.
Hi, how are you?
I'm good. Karibu sana. Tell us a little
sana.
bit about yourself and what is this muscle therapy?
So my name is Njenga.
Yeah.
I'm a muscle therapist. I've been doing this for the past 9 years. So muscle therapy is manipulation of body tissues, which help to increase movement.
Yeah.
It helps to relieve pain and helps to increase the chemical flow in the brain.
Yeah.
So it is an array of different modalities where we use both hands-on pressure and sometimes we might use a tool which helps us to stimulate the neuromuscular system.
Yeah.
Yeah.
So somebody looking at it from outside will just see it's a massage. What's the difference between muscle therapy and a massage?
So massage basically
Yeah.
is an instruction of movements that somebody is given. But with muscle therapy, what we do is you look at the clinical aspect of the body.
Yeah.
Somebody maybe has come in with pain and they need their pain being sorted. So what we do is we look at, should we use physiotherapy? Should we use acupressure? Should we use any different form of modality to help our clients' need so that they get better? Yeah.
So ideally, and at the bottom of everything, is releasing of tension from the muscles.
It is making a client feel better. So meaning that if they come in with pain,
Yeah.
they should leave feeling better.
Yeah.
If they come in with tension, they should leave feeling better.
Awesome.
So it is just you making the modality being known that we have not used this today, we have used this in form of helping you achieve the required pain release or maybe
Yeah.
tension. Yeah.
Now, on this show, we highlight wellness and healing modalities that are connected to mental and emotional well-being. And I'm sure some viewers might be wondering, how is muscle therapy related to emotional and mental well-being? So tell us.
Okay, now what happens is, you see, when we look at the body is a connection of tissues.
Yeah.
But the thing about it, it is this connection bring the body into one. So meaning that the body has to start a plan so that it's able to achieve whatever it needs to achieve.
Yeah.
So for example, if somebody wants to move his hand, it is the brain which will start the process, and then the process will go to the required system. For example, if it's the nervous system, which will make the hand to move.
Yeah.
So the connections themselves is what makes the body become one tool. So if we see the body as one tool, it means that also when you are treating the body, you can't treat it as a part. It has to come from the same modality.
Yeah.
So that's why we look at the body first of all in form of the brain, and then the information is sent into the rest of the body. And then the rest of the body will send the information again back to the brain. This is what we have come with.
Yeah.
Yeah, so it is actually something that first of all has to come from the brain, and then now that it sends to the body. Yeah.
Now, I see in our, our traditional way of thinking is that we are very separatist. We think the body is separate from the mind, is separate from emotions, is separate. And as you're saying, the body is a connection, but then within the body there is another bigger part of us, which is our emotions, our thoughts, that actually determine how we express as physical, as a physical person. And most of us don't see the connection. Can you help us understand the connection? Because most people don't understand. I might be feeling pain in my finger. It's not connected to anything I'm thinking or anything I'm feeling. It's just a pain on my finger. Tell us about that connection.
You see, we are designed in form of structures.
Yeah.
So ideally, like when you look at a house, the first thing you'll see is that there's a foundation.
Yeah.
After foundation, they'll take it to another process.
Yeah.
By the time the house is finished, there's something called the finishing,
Yes.
which is now the roofing and all that. That's the same thing that we're designed. So ideally, when we look at that, the first thing that we need to understand is our bodies are chemicals. Because ideally, like 75% of the human body is water.
It's water, yeah.
So meaning that there is a flow that moves from one area to the other. So like emotions are chemicals at the same time. So they have to move from one direction to the other.
Yeah.
So the thing about the brain is that the brain is a magic. And the funniest thing is that now is when people have started realizing what the brain is all about.
Yeah.
Back in the days, the brain was more or less put into, how would I put it, put into structures.
Yes.
In that there's the parietal lobe, there's the medulla oblongata,
Yeah.
there's the, so like now we look at what is the medulla oblongata doing, what is the parietal lobes doing. But now what is happening is whatever will affect the medulla will affect the parietal lobes.
Yeah.
So it is now us getting what is happening inside the brain, which is the chemical reaction, that makes now one start to realize that it is that reaction that has flown, that has moved from the brain and sent a signal, for example, to the hand. And then now the signal, which is coming from the hand, comes with another signal or a stimulation, which is now pain, or I need to remove my hand. So the emotional part is the chemical reaction, and once now that is put into place, you now understand that it is the emotion or the pain that is reverted back to the brain.
To the brain.
Yeah.
And of course, what is coming from the brain to cause the flow of emotion is the thought.
Exactly.
So it's the thought, the emotion, and then the physical manifestation of that combination.
Yes.
So
yes.
I'm just wondering, because a lot of people feel pain. Okay, even just thinking about how life is about feels. How you know you're alive is because you're feeling something.
Exactly.
You're feeling bored, you're feeling what? So what happens when the emotions get stuck? Because you're saying they're supposed to flow,
Yes.
so that the system can work the way it's supposed to work. So what happens when the emotions get stuck? And do they get stuck like in an organ or in a system? Yeah.
So the brain is amazing because it would send pain signals to and from it. So the thing that happens is the pain in the body or is the pain in the brain? Okay?
Yeah.
Because these are two different forms. That's why I've
Physical and psychological.
And psychological.
Okay.
Because that's why, for example, I've given the sample of grief.
Yeah.
Yeah? In such a way that grief would be felt, first of all, emotional. Yeah?
Yeah.
And then now the emotional part weakens the immune system in such a way that you can even get a malaria attack and it affects the whole body structure. For example, I would give it in such a way that I remember when I lost my father, my mom went into grief in such a way that she got malaria to the point she went to ICU.
Wow.
Yeah.
And nobody would connect the malaria to the grief.
Would connect.
You just blame the mosquito.
Yes, yes.
Yeah.
But now the thing is, it's the immune system which was compromised, and it was very susceptible and weak to anything. So that even when you get a small mosquito bite, it can become a malaria effect.
Yeah.
Yeah. Because now the body is on acidic, on an acidic level, and it is uncontrollable.
Yeah.
Yeah.
Wow, it's good that you've mentioned about acidity. When the body, what happens when the body is acidic and what happens when the body is alkaline? And what is it on a mental and emotional level that causes the body to be either acidic or alkaline?
So number one, what acidity does to the body, acidity increases inflammation. Inflammation makes the body, first of all, to have pain. The sensations go high, and apart from it, also the blood flow movement is affected, meaning that there are areas that will feel more pain than others because the body is inflamed. Apart from it, also the heat levels of the body are usually affected. So when actually the body becomes acidic, it means that also the immune system is compromised. So you getting an infection can be as easy as possible. So that affects the body because now the balancing of the chemicals is affected, where now the brain cannot give the right information to the body, hence the body is not giving the right information to the brain. So what happens is that the autoimmune system starts to fight itself. Okay? In such a way that now you get weakness. That is bone density, your muscles get pain because they are not getting enough nutrition from the from the food that you are eating also. So this will affect definitely how you think, because number one, you are not acting out of yourself, but it is pain which is making you act out of it. So even when you are conversing in your conversation, you're not having a normal talk because you are in pain. So your conversation are how to handle the pain.
The pain. Wow. So I see a lot of connection between how we think, how we feel emotionally, and then how we feel physically. And a lot of all of that is connected, but most of the time we don't see the connection. We try to deal with things as separate, especially now at this point that we are dealing with corona and people are worried. You know, you're talking about acidity, and I'm sure there are certain emotions that cause the body to be more acidic than others. Tell us about that. What emotions, for example?
Depression, stress. Those are some of the things that make the body get imbalances. And once the body is in balance, it means that also the blood pressure can go high. Once the blood pressure is high, it means that you getting an attack can be as easy as possible. Because ideally it means that the body is flaring up, hence giving misinformation to the brain.
Oh, that's what it is.
Exactly.
Misinformation.
Misinformation. Because number one, you are acidic. You are in pain. So the body cannot say, let's bring blood flow to this area to relieve the pain. The body will tell the brain, we are in pain and we need help now. So the brain will function out of the help it needs. It will not function that we need, maybe for example, to stretch to relieve the pain.
Wow. So we cannot thrive as long as we are acidic. We will just be on survival mode.
Exactly.
Wow. I love this. Wow. So I hope you're learning as much as I'm learning. So one last thing before we go on a break.
Yes.
There's this, you know, stay-at-home order all around the world. And most people are sitting at home, losing their jobs, you know, basically couch potatoing because we have to social distance, and some people are in like apartments, they have nowhere to run. What effect does this have, their emotional state, and now again, what does that have on their physical?
Number one, one thing that we always have to remember, we are animals. Okay? And thing
we
about
are
being
animals. We
thing
thought
about
we are humans.
No, being an animal
Humans
is
are animals.
we are emotional beings. So that's why we are called emotional creatures. But all in all, even being a creature, you're an animal. And according to animals, we live through survival. And when we don't survive, we get pressure. For example, seeing a hungry hyena, seeing a lion, let's say for example, a lion has attacked a buffalo, and there's a hungry hyena that is hungry and does not have a chance of eating. The only thing the hyena will do is that it will give its all to make sure that it gets even a bite from the meat of the lion. Even if it means that the lion will kill it, it doesn't care. So food actually makes us not to have the survival instincts. Okay? So sometimes that's why you find that when somebody is in too much pressure, their body also becomes unbalanced. That's why you feel like you want to eat all the time.
To calm down the pressure.
It is because there's so much pressure going on in your brain, and the brain does not know how to handle pressure. That's why sometimes there are some people who told just meditate or just breathe in and breathe out to make sure that you're bringing the pressure down. Usually when a human being is under pressure, they get a lot of imbalances, mostly acidic imbalances. Yeah.
Awesome. I want us to go on a break, and when we come back we'll be talking about really who can benefit from this modality and actually the practical application of the modality. So don't touch that dial, stay there, we'll be right back. Welcome back to this episode of Being Me. I'm your host Caroline Gaiduma, and in today's episode we are here with Njenga, a therapist who does something called muscle therapy, and we are talking about how he works our muscles to help us release tension and pain. And while we were on a break, we were talking about what are the things you encounter in your therapy. We were talking about emotions and how they flow through our body. So my question is, in the therapy itself, do people get emotional when you touch the pain, and maybe it's psychological pain that is showing up as physical pain? What happens?
Number one, there's a lot of emotions that I get from my clients, because number one, you're dealing with chronic pain. This is something that has been there for long. So you're trying like to reverse it and make it, see if you're able to like release the tension completely, and then also help them to build up on maybe exercise and strengthening of those areas that are affected. So it is sometimes quite painful, because you might find somebody who had an injury and it had stayed for like 15 years without being fixed. So like you are the only one who is going to fix it. So it's like you're starting from square one. Others, you find that they have already gone to therapists. Others have not, the therapists that have not worked, it's like you start all over again. So there's a lot of emotions that we get from our clients, but not all of them too.
Because some it could be just a physical pain that maybe doesn't have such an emotional,
Exactly. It's there are two forms of pain. There's acute and there's chronic. Acute has not stayed more than a month or two. It's just starting up. But with chronic has taken more than 2 months plus, even sometimes 20 or 30 years. Because you can find somebody who has stayed with the pain for 25 years.
Wow.
Now you're trying to treat that pain.
And they have a story about this
They
pain.
have
like
a lot
their
of
life
stories.
revolves around that pain,
Yes,
right?
and if you listen to their stories, you get even sad. Because others have spent millions going to doctors. Hence still the pain remains.
So as a therapist, can you actually help a client understand that this is not just physical pain, that there could be psychological pain involved, and there could be things in their life that they need to shift or change for the pain to go away? Well,
what we do actually, number one, before we see a client, we give them a form to fill. So from the form, we now can have a discussion. So even if somebody has the emotional pain, you find building up on a conversation helps me as the therapist to understand where the pain is, how the pain came, and how I'm going to treat it. At the same time, it helps me to have a conversation with my client, for them to understand the process of what I'm using, so that we are able to deal with their pain. So definitely we do have conversation with our clients as we treat them.
And earlier on you had mentioned that we are actually made of chemicals. We are actually an expression of some brain chemicals expressing, you know. So how can we alter our brain chemistry, and how can we do that to reverse pain maybe, or to just be feeling good?
Naturally or using therapy?
Both.
So number one, God created us in such a way that the brain was designed to heal itself. The thing that the brain does is to look at what should it heal. Should it heal it with nutrition? Should it healing with exercise? Does it need therapy to heal it? So it all depends with the modalities of what the brain is telling you. Yeah.
And how would you know? How would I know? Like, if I'm here and I'm suffering from, let's say, chronic back pain, chronic lower back pain, and maybe we have done some therapy and I'm feeling this is manageable, this is okay. So how do I know how to continue to ease the pain? You know?
So for us, like for me, what I will do when I'm working with my client, I do give them advice on what to do. So for example, there are some people who come in with pain and you find that you will not give them exercise. If you give them exercise, they'll get inflammation. So also it all depends with how I look at the pain and how I'm treating it. Yeah.
So it's important for somebody to actually see a professional so that they can get the advice that they need based on their condition, on what will work for them, right?
I would say it is advisable because number one, we don't know everything. Hence, when we get help, we get a solution to the problems that we pass through.
Yeah. Awesome. Now, I mean, I'm really fascinated by the connection between the whole system of our body. That, thoughts are connected to emotions, are connected to our physical body, and how our body feels and how it actually expresses itself. And that's the connection I would love us to emphasize when you're talking to us about who needs to come and see you, because somebody might be saying, I don't have pain. But maybe they just went through something tough and they don't know that there's emotion about to get stuck somewhere. So are your therapies mostly preventative or maintenance or healing? Yeah.
So we do both, preventative healing and maintenance.
Yeah.
So the idea is what the client comes with. For example, if they come in with pain, then that is a management. Or first of all, rehabilitation before it goes to management. If they come in to relax, then that's another different form of modality. For example, we can do hot stone, we can do maybe deep tissue, or we can do Swedish, just to allow the blood to flow, which will help in nutrition and help also in the chemical reaction of the body. So yeah.
So for somebody who, and this is what I like about our show, it's because we also try to help people to be proactive, proactive about their mental, emotional well-being. So who is this that you would advise to come, apart from somebody who is in pain? What are some of the things that will happen in somebody's life and you'll be like, Ebu, just go and see Mark?
So number one, I feel everybody needs therapy. Because ideally our bodies, let's say for example, let's give it on a monthly basis. Every month, your body has to be renewed. There are some cells which die, there are some cells which rejuvenate, there are some cells which they expand, others they just die off. So every month you find that your body is working and overworking itself to the point that it starts to get tension. So meaning that the activity inside our body is what actually which gives us fatigue and sometimes pain. So I feel everybody needs therapy because we work with systems in our bodies and these systems do get tired and sometimes they need a boost and a help to allow the flow to continue. Yes.
So it's like a car that needs service after certain mileage. Perfect. And you're just telling us right now, our mileage is just 30 days.
Yes, yes.
After 30 days, we are due for service.
Exactly. And then the thing is, we for us, what we look at is mostly a maintenance thing. Because I believe everybody has to use their body each and every time. Not every time.
Every second.
Yes, you're using your body. So meaning that for the body to be used, there is a lot of activity, mostly the chemical reaction part, so that the body also moves in the form that you want.
Yeah.
So definitely with time, these chemicals get fatigued, and they start getting imbalances. Hence now the acidity starts to increase.
Yeah.
So with time, the body needs some work to be done.
Yeah. And I think it's like a car. Like how can you be running your car every day and not expect it to break down if you're not servicing it? What are some of the things you've encountered in your practice that are just a result of non-maintenance? You know, it's somebody is here because they did not manage their body, their vehicle.
Mostly I get spasms, and mostly back spasms and shoulder spasms. Usually, like right now, the whole world is it's technology.
Yeah.
You cannot lack a smartphone, you cannot lack internet. Those two things. So everybody is on their phones all the time. They are getting abnormal neck positions and their hands. At the same time, you are sitting on a computer. Like right now, we're told you stay at home
and work at home.
Exactly. Meaning most times Zoom calls, things that are using internet. Sometimes internet, as we say 3G and 4G, they usually have radiation. So definitely the radiation affects the brain functionality. That's why you find sometimes you get fatigue and your eyes start getting pain. It's because you're getting tired. So with time, you would need help. So
if you're doing maintenance, just maintenance, you will not get to those places where you're getting spasms.
Exactly, because now you have encouraged enough blood flow. So when the body wants to tense up, there is a stimulation reminder to the brain that we want to tense up. So the brain will send enough blood flow into that area, and then the muscles release.
Wow, this has been so informative. I'm just beginning to see the importance of the well-being of this body, this vehicle, and how much, you know, we need to put in more proactivity in its maintenance so that we can thrive. Because if our body itself as a system is not thriving, then we cannot thrive. We cannot achieve our purpose. We cannot create abundance, all those things.
Definitely, yes.
So Mark, how can people find you? Where can they find you?
We are located in the Healing Clinic. It's in Westlands. We are in an apartment called Connaught Apartments, and we are a physio and massage therapy center, where we focus mostly on alternative therapies to help our clients be satisfied.
Wow, so you mentioned we are online. So online, do you have online presence?
Yeah, we have Google. We are on Google. We are the Healing Clinic Massage and Therapy Center. That's where you can find us. We're also on Facebook, the Healing Clinic Massage and Therapy Center.
Awesome.
Yeah.
Thank you so much. That was an
welcome.
awesome interview I've had with you. I'm so enlightened. I'm feeling so powerful because information is power.
Exactly.
And now I'm beginning to understand, you know, the connection between everything, mind, body, soul. And I hope that you, dear viewer, have really learned as much as we all have. And I'm sure that you have made a resolve to maintain your system, maintain your body. It's a very important vehicle that carries you to the achievement and fulfillment of your purpose. And with that, we'll come to a close and hope that you'll join us in the next episode of Being Me. I've been your host, Caroline Gaiduma. Until then, bye-bye.